The Fairbanks Opiate Workgroup met today to begin working towards a solution on the area's opioid addiction issue. Jamie Schwartzwald reports.
Once we get him out of detox, then what?
Those with loved ones battling opioid addiction joined about 40 other stakeholders in a meeting designed to open the door to action on solving the problem. The group identified gaps and barriers to the solution, one of which included denial that a problem even exists. Other gaps include a lack of prevention services, a shortage of local rehab services, and most notable, the lack of beds in the Gateway to Recovery Detox Center dedicated to opiate addicts. Perry Agosiak, the Fairbanks Native Association's behavioral health director, says federal regulations limit the detox center to allow just 2 of its 16 beds to be dedicated to opiate addicts. Barbara Michael, whose husband is one of those addicts, says the continuum of care is too fragmented locally.
When someone wants help, it's a very hard process to find help. Services aren't in one area. You bounce around from agency to agency, and there are just too many gaps for them to fall through.
The group also looked at potential solutions, which included awareness campaigns, as well as establishing post-addiction treatment facilities and making available medications designed to help fight the effects of addiction. Michael says there needs to be a path to recovery model locally, similar to what's in place in Alaska's capital city of Juneau.
I'd like to see a crisis center in Fairbanks, a place that is an entry point where people can go that want help, that puts them in touch with all these agencies in one stop, just so that they don't fall through the cracks, they're not lost in the system, and they have someone that can guide them through that process that's knowledgeable on all the services available.
Last regular session, the Alaska legislature passed and Governor Bill Walker signed into law Senate Bill 23, which removes civil liabilities from doctors who prescribe and trained bystanders who administer naloxone or Narcan, an opiate antidote which reverses opiate drug overdoses. Governor Walker says Alaska's opioid epidemic may rival the budget deficit as the biggest issue facing the state.
It's a state issue, it's a local community issue, it's a local family issue. It really is. It's one that it is growing, and by the biggest epidemic I think that we have seen is this opioid abuse and addiction. It's a very sad situation, and it's one that we are taking steps legislatively, but you really can't legislate this away. You can give tools through legislation. That's what we've done with Senate Bill 23.
Jamie Schwartzwald reporting.